Hello, welcome to my YouTube channel. For you to work, for you to perform your daily activities, for you to participate in recreational activities such as swimming, or for you to participate in professional sporting activities, you need a functional and a healthy knee. A lot of people that come to physiotherapy or orthopedic clinic complain of knee pain. In order to know what is causing your knee pain, and in order to know the best treatment option available for you, you need to understand the anatomy and structure of the knee, and that is the essence of this video. Please, if you are new to this channel, kindly subscribe to my channel and hit the notification button. By doing so, you'll be notified whenever we release any of our amazing videos. Also, don't forget to give this video a thumb up. So, in my hand here is a model of a knee joint. Please, this is a model. This is not a real skeleton. If you're afraid of human skeleton, you need to calm down. This is not a real human skeleton. This is also a model of human skeleton. We mostly use model to teach students anatomy in medical schools and also to demonstrate to patients the structures of their body and what is affecting them or what is causing their pain. So, by way of introduction, the knee joint is the largest joint in the body. Is a complex joint. In anatomy, a joint is a place where two or more bones meet. As you can see in the case of knee, there are more than two bones here. This bone, this is a bone, this is a bone. So I'm going to call their names when I discuss about articulation. The knee is subjected to lots of stress. For you to walk, for you to jog, for you to even run, the weight of the body is transferred to the knee, from the knee to the foot, and from the foot to the floor. So because of a lot of stress that the knee is subjected to, is also prone to many injuries. The knee is a hinge joint. It allows movement in flexion and extension. For articulation, as I say, the knee is a complex joint. It's made up of more than two bones. The first bone is this. This is a femur. It's called the thigh bone. The bone you see here. This is a tibia, the shin bone. The bone you see here. Then, this is a patella. The bone you see here, kneecap. So, these three bones make up the knee joint. Note, the fibula does not contribute to articulation of knee joint, even though it is here. Then, for articulation, there are two articulations here. We have tibio-femoral articulation and we have patello-femoral articulation. Patella and femur, tibia and femur. There are two articulations here. So this is the structure of a knee joint. Remember, it's the largest joint in the body. Also, for a joint to be stable, for a joint to function optimally, and for a joint not to be subjected to dislocation or subluxation, there are a couple of structures that gives joint its stability. In the case of the knee joint, the ligament plays a major role. Just like every other joint, the ligaments in the knee helps to stabilize the knee joint. There are about 4 ligaments in the knee. There is lateral collateral ligament, this. There is medial collateral ligament, this. There is anterior cruciate ligament, this. There is posterior cruciate ligament, this. These 4 ligaments together help to stabilize the joints. Remember, a ligament is a tough fibrous tissue that holds bones together in a joint. Also, muscles of the thigh, muscles that are found here, and muscles that are found here, and calf muscle contribute in knee stability. For the muscle at the anterior compartment of the thigh, the quadriceps muscle, they also contribute in knee stability. For the muscle at posterior side of the thigh, the hamstring muscles, they contribute to knee stability. There are other soft tissue structures in the knee joint that help the joint to function effectively. We have a hyaline cartilage, though the hyaline cartilage may not be seen well here because this is a model. In a real joint, you see the end of femur here. This place is covered by thin layer or white cartilage. It is called hyaline cartilage. It also covers the end of tibia. This hyaline cartilage provides smooth end for these bones so that they can move freely without much friction. It's also pertinent to note that the knee is a synovial joint. There are some cardinal features or cardinal characteristics of a synovial joint. Number one, there is an inter-articular cavity. When you talk about joint cavity, you talk about space between the two bones that make up the joint. The inter-articular cavity or the joint cavity of the knee is the space between the femur and the tibia. That is here. Okay? So, there are another characteristics of a synovial joint. There is a thin layer of synovial membrane. It's just like an envelope that covers the joint like this. This synovial membrane secretes a fluid called synovial fluid. The synovial fluid helps to lubricate the joints. Okay, the synovial fluid helps to lubricate the joint and prevents or reduces friction between the articular bones of the knee. Another characteristic of a synovial joint is that they are stabilized by a ligament. Just as I said, the four ligaments that stabilize the knee joints are lateral collateral ligaments, medial collateral ligaments, anterior cruciate ligaments, and posterior cruciate ligaments. Don't forget, this is a right knee. And in anatomy, structures that are away from the body are called lateral structures. That is why this particular ligament here is called lateral collateral ligaments. Structure that is closer to the midline is called medial structure. This particular ligament is called medial collateral ligaments. Structures that are in front are called anterior structure. That is why this ligament is called anterior cruciate ligament, these ligaments. Then structures that are behind, posterior structure. This is posterior cruciate ligament. Another characteristic of a synovial joint is that the articular bone, the end of the articular bone, is covered by a thin layer of hyaline cartilage. As I said previously, the end of femur and tibia is covered by a thin layer of white hyaline cartilage. Another feature of a synovial joint is the presence of a fibrocartilage, though not in all synovial joints. But for a synovial joint like the knee, the shoulder, the hip, they have a fibrocartilage that also adds to stability and helps to absorb shock in the joint. In the case of the knee, we have a fibrocartilage called meniscus. Okay, the plural is menisci. We have medial meniscus, this is the blue structure, and we have lateral meniscus, this one. So this meniscus helps to absorb shock from the knee joint. They also contribute to knee stability. However, they can be injured, which I'm going to mention during the discussion about knee pathology. And another feature of a synovial joint, which is common in knee, is that they are well vascularized. What do I mean? They have good network of blood supply. For knee to function effectively, it needs to be well vascularized. The knee also have a nerve supply. We have articular nerves from a femoral nerve or tibial nerve that supply the knee. So this helps to transfer sensation from the knee to the spinal cord and to the brain. About movements, the knee is a hinge joint. It allows flexion and extension. It allows flexion and extension. Flexion and extension. When the knee is flexed or when the knee is bent, it can also allow rotation. When the knee is bent like this, it can allow external rotation and internal rotation. That is for movement. For knee pathology, because the knee is a complex joint and the larger joint in the body and is also subjected to loss of stress because it's a weight-bearing joint, a lot of problems or pathology affect the knee. I'm going to name some of them. And don't forget, if you check my channel, I made a video about knee osteoarthritis and other knee pathology. Number one knee pathology that is very common is osteoarthritis of the knee. Osteoarthritis occurs when the articular cartilage that line the femur and the tibia begin to degenerate due to old age or due to other medical condition, giving rise to pain, stiffness, swelling, crepitus, that is cracking sound when you move the joints. Osteoarthritis is one of the most common knee pathology, especially in adult population from 50 years and above. Another pathology that affects the knee is dislocation. Dislocation occurs when these two bones move in relation to each other. Maybe when the tibia moves away from its normal position, or when the femur moves away from its normal position. It's called dislocation. It can also be referred to subluxation if the dislocation returns on its own. Trauma is one of the leading causes of dislocation. Another problem that can affect the knee is fracture, inter-articular fracture. In this case, you are talking about fracture that is occurring within this joint complex. Maybe if there is fracture of end of femur, or fracture of end of tibia, or fracture of patella, it's called inter-articular fracture. Inter-articular, within an articular surface or within a joint surface. Then another problem that can affect the knee joint is patello-femoral pain syndrome. As the name implies, patella and femur. When there is a problem between patella and femur, patello-femoral pain syndrome. Patello-femoral pain syndrome. It can also give rise to knee pain. Another pathology that can affect the knee joint is tendinitis, that is inflammation of a patellar tendon or patellotendinitis. There are also another pathology called patellar tendinopathy. If you check my channel, I make separate videos about all these conditions. Then there are also rheumatoid arthritis that can affect the knee joint. Rheumatoid arthritis is an autoimmune disease. Then there could be reactive arthritis, gonococcal arthritis. People that participate in sports, or for young athletes, there are another condition that can affect the knee. This is an injury to the anterior cruciate ligament. Some can lead to some sporting activities such as football, volleyball that involve jumping and landing from a surface can give rise to injury or tear to these ligaments, anterior cruciate ligaments. There could be sprain of lateral collateral ligaments or medial collateral ligaments. Among all the four ligaments that stabilize the knee, the least injured is the posterior cruciate ligament. This posterior cruciate ligament is very strong and hardly injured. Then, for muscular movement, as I said, apart from ligaments, muscle also contributes to knee stability. And these muscles are knee flexors and knee extensors, quadriceps muscles, and hamstring muscle. Having listed the knee pathology, if you check my channel, you're going to see videos on some of these knee pathologies and some exercises you can do to help improve your knee range of motion, or to relieve pain, or to relieve swelling, or to relieve stiffness if you have knee pathology. I'm then going to talk about how to take care of your knee. This video is clinically oriented, so I'm going to talk about how to take care of your knee as a physical therapist. Number one thing you need to do is to exercise your knee. Exercise have been proven to improve knee function and to prevent many knee pathology. There are ranges of exercise you can do. You can go into walking around in your environment or within your premises, cycling, jogging. This could help to improve knee range of motion and to prevent any form of pathology in the knee. Number two is good diet. Number three is lifestyle modification. There are some lifestyle changes that need to be done if you have knee pathology, or if you want to prevent your knee from further pathology, like avoiding alcohol abuse or substance abuse. Cessation of smoking can help to improve your knee function or relieve knee pathology if you have any. There are another important aspect of knee care that is supposed to be taken seriously, especially in young population. If you want to start any new exercise, say you want to start mountain climbing, you should progress your exercise. Some of the youths that report to the clinic with knee pain or acute knee pain complain that this started when they commenced a new activity. Maybe they went to the gym and started leg press with a heavy load, thereby stressing the knee beyond its strength. This could lead to knee pain. Therefore, you must progress any activity. If you want to go for mountain climbing, take it gradually. If you go to the gym, make sure you take the exercise you want to start gradually. Finally, If you have any knee pathology, if you have knee pain, don't self-medicate. Try to consult a specialist. Try to see your physical therapist or your doctor. This will help you to maintain a healthy knee. Remember, the knee is very important for you to perform your daily activities. Don't forget to take care of your knee. If you are new to this channel, kindly subscribe to our channel and hit the notification button. By doing so, you'll be notified whenever we release any of our amazing videos. Don't forget to give this video a thumb up. Thank you for coming to my channel today. I look forward to seeing you again. Bye.